Hello everyone. My presentation today will be on proactive health communication campaign on diabetes mellitus in Los Angeles County. Ebele Onyanuse, October 20, 2019, DMPU 705. What is diabetes mellitus? It is a disorder in which the pancreatic cells fail to produce enough insulin to maintain normal blood sugar, or the body cells are insensitive to the insulin produced by the pancreatic cells. Classifications of diabetes mellitus: type 1, type 2, and other types including gestational diabetes or prediabetes. Type 1 is considered as autoimmune or idiopathic. Type 2 ranges from relative insulin deficiency to disorders of the insulin secretion, while type 3 is genetic defects in B cell function, genetic defects in insulin action, disease of the exocrine pancreas, and endocrinopathy. Prevention of diabetes mellitus. It can be achieved and maintained by maintaining healthy body weight with normal body metabolic index. Be physically active by maintaining at least 30 minutes daily physical exercise, eating healthy diets rich in vegetables, avoiding sugar and avoiding intake of saturated fat, avoiding tobacco use because it increases the risk of diabetes mellitus and cardiovascular disease. Diagnosis. Early diagnosis is important and can be achieved through inexpensive testing of blood sugar. A fasting blood sugar of 126 mg per deciliter or 7 moles or greater on 2 separate occasions confirms the diagnosis of diabetes mellitus. Treatment. Diabetes can be treated by healthy diet, daily physical exercise, lowering of blood glucose, avoiding risk factors such as tobacco use, which damages blood vessels. Treatment of type 2 diabetes requires insulin injection, while people with type 2 diabetes are treated with oral medication, and in some cases, insulin can also be used. It is important to include maintaining normal blood pressure and proper foot care in the management of diabetes. County and subpopulation that is considered at risk. The county I live in and I want to discuss is Los Angeles County in Southern California, and it is most populous county in the United States, which with a population of about 10 million people, The subpopulation at highest risk of diabetes mellitus in Los Angeles County is the Black community. The Black community constitutes about 8% of the total population of the county. Health risk, crisis, and health promotion issues. The prevalence of diabetes in Los Angeles County is rising, with 1 in 10 adults having the disease. The prevalence of disease among Blacks in the county is 12.4% compared to 6.7% among whites. Blacks have the highest percentage of obesity in the county, which is about 31%, and 24% poverty rate. There is significant health care disparity by the race in Los Angeles County, with Asians at 12.6%, Latinos at 12.9%, whites at 15.6%, and blacks at 6.0%. This is because the Black community has the lowest rate of health insurance coverage among different ethnic groups in the county. The total direct cost of treating diabetes mellitus every year is estimated to be more than $6 billion, which makes it one of the costliest chronic conditions in the county. Diabetes is the 5th leading cause of death in Los Angeles. The mortality rate due to diabetes among blacks is about 130 per 100,000 compared to diabetes related with diabetes related death of 75 per 100 among the whites in the county. The County Board of Supervisors have realized the need for more awareness about diabetes and its complications and declared November 19 a Diabetic Awareness Month. Jim Watson's theory of philosophy and science. Jim Watson viewed the human being as a wholesome entity that should be valued, cared for, respected, nurtured, helped, and comprehended, which qualifies him or her as a fully functional individual. Watson believed that healthcare should be holistic because it is central to the process of caring in nursing practice. She defined nursing as a human science of individual and the experience of health and illness mediated by the human transactions involving professionals, personal, scientific, aesthetics, and ethical interventions. Watson's character factors dignifies human aspect of work of nursing and the measures of satisfaction felt by people who receive care, which contrasts the conventional medicine curative factor. How Watson's theory is used to address diabetes mellitus in the Black community. Jim Watson's model is in line with Healthy People 2020 because both emphasized on the importance of providing healthcare with respect, understanding, and without discrimination. Jim Watson's notions of health included the prevention of illness and respectful care for people with the disease. This agrees with the part of the Healthy People 2020 objective to prevent disease such as diabetes mellitus among the groups that are at risk, and to properly control the blood glucose among people with the disease. Healthy People 2020 formed a partnership with the Diabetes Advocacy Alliance to achieve its objective of disease prevention and provision of the quality care to the diabetics. Why is it a good theoretical approach? Jim Watson's model is a good theoretical approach because it views is that every human being should be valued, respected, and cared for. It has been same approach with the Healthy People 2020 objective of lowering or eradicating healthcare disparity in the management of diabetes among different ethnic communities. The partnership of Healthy People 2020 and the Diabetic Advocacy Alliance is implementing diabetic care plan that included culturally sensitive strategies, protocols that are structural for the disease management, use of services of diabetic educators, adequate involvement of nurses in healthcare provision and other healthcare professionals to achieve the desired management outcomes among diabetes in African American County. Multimedia campaign to address the issue of diabetes mellitus. Diabetes awareness campaign is important in reducing the effects of the diabetes or the disease, just as the National Prediabetes Awareness Campaign in making Americans aware of their risk for the disease. Through light-hearted public service announcement, other methods include use of pamphlets and posters on the buses and billboards. World Health Organization is mounting an awareness campaign to help people understand the causes, symptoms, treatment, and complications of the disease through the television, radios, internet, emails, flyers, and magazines. Healthy People 2020 have embarked on an awareness campaign to show that lifestyle changes in the management of type 2 diabetes are very important and cannot be replaced by the medications. This can be achieved through robot call, bench advertisements. Awareness campaign is also diabetes self-management education among diabetes to reduce the rate of short and long-term complications of the disease. This is possible through the use of diabetes educators during doctor-patient section, text messages, flyers, posters in restaurants, stores, and gas stations. Here are my references. Thank you for listening.